Let's bring in Dr. Ashish Jha. He's the dean of Brown University School of Public Health. Dr. Jha, boy, looking at that piece, everything seems really dire. I'm getting totally a flashback to March 2020 when everything was shutting down and not going well. But you say don't panic. This is not that.
Yeah, good morning, Hoda. Thanks for having me back. We are not in March 2020. We just aren't. We have fabulous vaccines. So yes, people are having breakthrough infections, but they're mild and people are doing great. We have lots of tests. I know test lines are getting longer, but we have still plenty of testing around. We know about how the virus spreads and we can protect ourselves with high quality masks. There is so much more that we have going for us at this point that there is no reason to panic. We can keep ourselves safe this holiday season and into the new year.
Yeah, as you said, healthy and vaccinated people are getting this Omicron and they seem to be doing okay. But here's my question. If you are elderly, you are vaccinated, you are boosted, should you be panicking?
No. I mean, look, if you are elderly and you're vaccinated, you certainly absolutely should be boosted. If you have a breakthrough infection still, which will happen, right, which will happen, you will likely do just fine. I mean, there's nothing 100% in life, but we're seeing breakthrough infections, even in elderly people. If they're boosted, it's turning out to be really mild. So I think just you want to be careful. No reason to go out and get infected, but you can avoid it. And if you can avoid it, I think you're going to do fine. And even if you get it, you'll be okay if you've been boosted.
Okay, so I'm picturing a lot of people now packing their bags. They're getting on planes, trains, they're going in cars, and they're going to go visit grandma. So you've obviously been at rest stops, been in airports, and you're about to go up to the front door of your grandmother's house. Should you do a rapid test before you go in? What should you do? What's the right protocol?
Yeah, my advice is if you're going to go visit somebody who is elderly or at high risk, first of all, let's hope everybody's vaccinated, everybody's eligible. I think a rapid test just before makes a lot of sense. It'll make sure that you're not contagious at that moment. And then I think, seeing grandma, giving her a hug, taking off your mask at that point is very reasonable thing to do. So that's what I would do. That's what I'm advising my family and friends.
So if you happen to be all together during the holidays and somebody gets a breakthrough case, because I was wondering, what would you do in your home? What would be the protocol? Should someone isolate?
Yeah, this is a really tough question. So obviously, if you're all together for the holidays and someone gets a breakthrough infection, it's tricky. That person absolutely needs to isolate because they are contagious for a while. CDC says 10 days. I think it's possible to shorten that with testing down to 5 or 7 days. But the truth is they do need to isolate at that point. And everybody else at that point technically depends on whether their vaccine status, may need to quarantine. It can be messy. I think there are ways of still getting through it, especially if there are lots of rapid tests available and people can use them. But no doubt about it, the person who was infected needs to isolate.
And just finally, if people are on the fence now, they're seeing all these numbers and thinking, should I travel? Should I even go in the first place? What would be your best advice to families wondering if they should get together?
Yeah, look, I think Christmas is so important. This whole holiday season is so important to people. We missed it last year. I would say if you are vaccinated, if the high-risk people are boosted, I think, and again, especially if you can have some rapid tests around, I think it's a pretty reasonable thing to do. It's so meaningful to so many of us that you've got to be able to get back with your life. And I think with vaccines, we can.
Somehow, when you're done talking, Dr. Jha, I just exhale and feel a lot better. So I just want to say thank you so much for being with us this morning. We really appreciate your time.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.